The VQ OrthoCare Catalyst-Propel OA with double Q-hinge is a double-hinge unloading osteoarthritis or OA brace. The brace can provide pain relief for either medial or lateral osteoarthritis, reduce load on meniscal injuries or repairs, as well as provide stabilization for ligament instabilities. In the brace bag, you will find the brace in a smaller plastic bag of accessories containing flexion and extension stops, a patient adjustment key, another set of condyle pads that are a different thickness than the ones on the braces, a small Allen wrench in between the condyle pads for adjusting the active thigh cuff, and instructions for use. The instructions for use will be covered in this video. Undersleeves and oversleeves in cotton lycra and neoprene are available for use with this brace. Undo the 4 straps behind the leg and fold the straps down so that they don't get tangled. Place the brace on the leg so that the top of the patella is lined up with the middle of the hinge, indicated by the gray extension stop. Press the brace down so that the side of the frame sits mid-medial and mid-lateral on the leg or slightly posterior. Tighten the straps according to the sequence on the numbered strap tips, starting with the upper calf strap and ending with the upper thigh strap. Adjust strap number 5 in the front of the brace so that the indentation of the tibial pad sits right on the crest of your shin bone. Do not over-tighten this strap. Stand up and walk around in the brace. Make sure it feels comfortable and that there are no gaps or pressure points. It is normal for the brace to drop slightly to find exact knee center. If you have a custom manufactured brace, it is contoured to your exact shape and is painted a specific color. The correction will be custom built into your brace, and there should not be any correction to adjust on your brace. Braces should first be adjusted to neutral. This means that the angle of the brace should follow the same lines as the patient's leg, even if the patient has a bow-legged, varus, or knock-kneed valgus deformity. On either side of the brace are hinges called Q-hinges, which change the angle of the brace. Insert the patient adjustment key into each side and turn until the brace is lined up with the patient's leg. Have the patient stand up and walk around to make sure the brace is comfortable and that they do not feel any pressure on either condyle pad. While sitting, insert the patient adjustment key into the Q-hinge on the medial or inside of the knee and turn a quarter turn clockwise. This should open up the compartment and pull the hinge away from the leg. Then insert the patient adjustment key into the Q-hinge on the lateral or outside of the knee and turn a quarter turn counterclockwise. This should push the condyle pad into the knee and apply a gentle pressure or correction to the knee. Have the patient walk around a little. They should only feel a gentle pressure on the knee at the lateral condyle pad. If the pressure is uncomfortable, adjust the lateral Q-hinge back 1/8 of a turn. If the patient feels no pressure at all, try an additional 1/8 of a turn counterclockwise. Do not overcorrect, as this may cause soreness or pain. While sitting, insert the patient adjustment key into the Q-hinge on the lateral or outside of the knee and turn a quarter turn clockwise. This should open up the compartment and pull the hinge away from the leg. Then insert the patient adjustment key into the Q-hinge on the medial or inside of the knee and turn a quarter turn counterclockwise. This should push the condyle pad into the knee and apply a gentle pressure or correction to the knee. Have the patient walk around a little. They should only feel a gentle pressure on the knee at the medial condyle pad. If the pressure is uncomfortable, adjust the medial Q-hinge back 1/8 turn. If the patient feels no pressure at all, try an additional 1/8 turn counterclockwise. Do not overcorrect, as this may cause soreness or pain. Sit back down and readjust if necessary. Finally, take a look at the active thigh cuff, ATC. If the correction caused one of the strap of the ATC to buckle, you will need to tighten down the strap so that it lays flat. Locate the small Allen wrench in between the extra condyle pads in the accessories bag. Take the liners off of the brace. To access the screw, unscrew the bottom part of the loose strap. Pull the strap off the rivet and place it on the next hole to shorten its length. Replace the screw and tighten. Replace the liners. If the end of the ATC strap extends past the frame, it can be trimmed with scissors. Have the patient put the brace back on and check to see that the ATC now sits flat against the thigh. If not, tighten down one more notch of the strap. Gradually get used to your OA brace, starting with only 30 to 60 minutes on the first day and increasing your wear time. Pain from osteoarthritis may take time to subside, and it may take a few applications to get used to your brace.